Hi, I'm Danielle Wilson, and I'll be performing my medication administration checkoff. I'm going to scan the room. So the first thing that I will do is I will make sure that I free myself from any distractions. I'll close the door to the medication room. I will not be taking any phone calls. I'll limit my conversations with my colleagues to important information only, and I will be practicing the no interruption zone policy. Okay, so first I have here my patient care order form and my MAR, my medication administration record, and I'll be comparing the two. So first, my patient, I have Jaguar J. Jones. His MR number is 417-6352. 417-6352. His date of birth is 8/25/1963, 8/25/1963. I see that he has an order for Novolin R regular insulin, U100 insulin, 10 units subcutaneously, 30 minutes before meals. Novolin R regular insulin, U100 insulin, 10 units subcutaneously, 30 minutes before meals. And I note that the indication for that medication is for diabetic patients to help regulate glucose levels in the blood. And I also note that he has an allergy to penicillin. So now I'll just work with my MAR form. And first, I'll perform hand hygiene. And I'm going to start my first check of rates. So I'm going to make sure I have the right patient. The right patient is Jaguar J. Jones. I'm going to make sure that I have the right medication. The right medication is Novolin R regular insulin, U100 insulin. And here I have Novolin R regular insulin, U100 insulin. The expiration date is 12/1/2025, so it is not expired. Next, I'm going to check that I have the right route. The right route is subcutaneously. And because of the medication and the route, I'll be giving the injection in the 0.5 milliliter insulin safety syringe. Next, I'm going to verify that I have the right dose. The right dose is 10 units, and I see on my vial that I have 100 units, so I am going to draw up 10 units from the 100 unit vial. So first, I would clean the top of my vial with an alcohol prep pad. And again, I'm going to check that I need 10 units. I'll draw up 10 units of air into the syringe, and I'll place that into my vial. Next, I'm going to draw up 10 units of insulin into my syringe, making sure not to get any bubbles. I'm just gonna get rid of any air bubbles. Okay, and I'll pull up my safety. I have 10 units, and you can see here, units. Okay, and I have my safety up. And before I would do anything else, I would make sure that I have another RN verify, because it's insulin, come and check behind me that I have the right medication, looking at the MAR, the right medication, the right dose, 10 units, and that other RN would check behind me for those things in particular, and check on the MAR. So I have the right, and I'm checking that I have the right time. The right time is 30 minutes before meals, which is now. And I'm checking that I have the right indication. So Novolin R, regular insulin, is given to diabetic patients to help regulate blood glucose levels. And I'm checking that I have the right documentation. The right documentation is that I have all the elements of a legal prescription are present. Okay, so next I will perform my second check. I'm going to have my note that I'll put on my syringe. First, I'll check that I have the right patient. The right patient is Jaguar J. Jones. I'm going to check that I have the right medication. The right medication is Novolin R, regular insulin, U100 insulin, Novolin R, regular insulin, U100 insulin. I'm going to check that I have the right dose. The right dose is 10 units. 10 units. The right route, subcutaneously. The right time, 30 minutes before meals. The right indication, Novolin R is given to diabetic patients to help regulate blood glucose levels, and the right documentation, that I have all the elements of a legal prescription present. Okay, so now I'm going to write my patient's name, Jaguar J. Jones. Jaguar J. Jones. I'm going to write the name of the prescription. So Novolin R, regular insulin, U100. And I'm going to write the dose, which is 10 units. 10 units. And I'll make sure that that matches. Jaguar Jones, Novolin R, 10 units. I'll put this on my syringe, making sure not to go above the 10 unit line so that I can see the unit line to check it again. Okay, so I have my vial, my MAR, and my syringe, and I will take these to my patient's room. Okay, so I'll enter the patient's room. I'm going to perform hand hygiene. I'm going to explain that today I'll be giving you your insulin injection, and I would raise the bed to a comfortable working height, and I'd lower the side rail. Now I'm going to start my last check, making sure that I have the right patient. The right patient is Jaguar J. Jones, and I'm going to use at least 2 identifiers here. Jaguar J. Jones, and I have here on his armband, I see Jaguar J. Jones. His MR number is 417-6352, 417-6352. His birthday is 8/25/1963, 8/25/1963. I also see that he has an allergy to penicillin, and he has an armband that says that he has a penicillin allergy. And at this time, I would ask him if he had any other allergies that we needed to be aware of. Okay. I would also check on my medication that I have Jaguar J. Jones, Jaguar J. Jones. Okay. So I have the right patient. The next thing I'm going to do is I'm going to make sure that I have the right medication. The right medication is Novolin R, regular insulin, U100 insulin. And here, in my vial, I have Novolin R, regular insulin, U100 insulin. Okay, I'm going to make sure that I have the right dose. The right dose is 10 units. 10 units. And also I have Novolin R, regular insulin, written down on my syringe. 10 units, 10 units, and I'm going to make sure again that I have 10 units. I'm going to make sure that I have the right route. The right route is subcutaneously. The right time, 30 minutes before meal, and it is 30 minutes before his meal. The right indication, Novolin R is given to diabetic patients to help regulate blood glucose levels, and the right documentation. So I have all the elements of a legal prescription present. Okay, so now that I have done my third check, I will perform hand hygiene. I'm going to put on my goggles and my gloves. Okay, and because this is an insulin subcutaneous injection, I'm going to give the injection in the abdominal region, and I will give the injection 2 inches, at least 2 inches away from the umbilicus on all sides. There's a 2-inch border around the umbilicus. I would not go above the costal margin, and I would not go below the pubic region, and I would not go past the anterior superior iliac spine. That leaves me with this horseshoe shape that I can give, that are very good for insulin injections, subcutaneous injections. Okay, so I am going to check the integrity of the skin and make sure there is no bruising. I will clean the area with an alcohol prep pad in circles. Okay. And next, I'll pull down the safety of my syringe. And if I were going, if I could pinch 1 inch, I would go in at a 45-degree angle, and 2 inches, I would go at a 90-degree angle. I can pinch 2 inches, so I'll go in at a 90-degree angle. And I'll throw this into my sharps container. Okay, and I will hold a little bit of pressure without massaging. And next thing I would do is I would make sure that our patient is comfortable. I would lower the bed, raise the side rail. I would get rid of my sharps container, and I would remove my gloves. And I would perform hand hygiene, and then I would document I would assess and document if he had any allergic reactions, and I would write down the procedure in the MAR and also what I assessed as his reactions to the medication.